Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 30 practice questions. Without the way, let's get started.
An older adult woman who has left-sided paralysis because of a brain attack is being cared for by a daughter in the home in which the daughter lives with her husband. The home care nurse interviews each member of the family separately, based on the significant information in each interview, which is the most important initial nursing intervention. 1. Be sensitive to the client's cultural beliefs. 2. Arrange respite care for the client's daughter. 3. Reinforce the daughter's responsibility to care for her mother. 4. Encourage the husband to help his wife with the care of his mother-in-law. The correct answer is 1. Be sensitive to the client's cultural beliefs. Rationale. Beliefs and values usually are held long-term and are ingrained within one's view of self. It is essential that nurses respect a client's beliefs and values, particularly for non-traditional healing practices, as long as they are not harmful to the client. Demonstrating respect and a non-judgmental attitude will help promote a trusting nurse-client relationship. In option 2, arranging respite care for the daughter is premature at this time. This may eventually become necessary. Option 3 is an inappropriate intervention by the nurse. Only the daughter can come to the conclusion that it is her responsibility to care for her mother. Option 4, this is not the priority. This intervention may be done after a discussion with the client, daughter, and husband. A family member requests relief from caring for a relative who has a history of excessive intake of alcohol and a rapidly debilitating malignancy. To which resource should the nurse refer the family member for respite care? 1. Hospice. 2. Meals on Wheels. 3. Ambulatory Care Center. 4. Substance Misuse Treatment Center. The correct answer is 1. Hospice. Rationale. A hospice program is an example of an agency that may provide or arrange for respite care in a healthcare facility or in the home. The caregiving role is physically and emotionally grueling, and family members may need relief from the caregiving role or a break to attend a family function or go on vacation. Meals on Wheels does not provide respite care. It provides nutritious, low-cost meals for homebound people so that they can remain in their own homes. Ambulatory care centers do not provide respite care. Ambulatory care centers provide care for people with conditions that do not require hospitalization. Services may include diagnosis and treatment of disease and illness, as well as simple surgical procedures in which the client returns home the same day. A substance misuse treatment center does not provide respite care. It provides a specialized service in the care and treatment of individuals who misuse alcohol or drugs. A nurse in a clinic is caring for clients in a variety of age groups. Which age group should the nurse anticipate will have the highest potential to demonstrate regression when ill? 1. Infants. 2. Toddlers. 3. Adolescents. 4. Young adults. The correct answer is 2. Toddlers. Rationale. Toddlers are less able to understand and interpret what is happening to them when ill. Therefore, they commonly regress to a previous level of development in an attempt to reduce anxiety. Infants already demonstrate behavior on the most basic level. Adolescents generally want to behave in an adult manner and therefore demonstrate a controlled behavioral response to illness. Although some young adults may regress to an earlier level of development as a coping strategy, regression commonly is not used as a defense mechanism when coping with illness. A nurse is assessing a 4-year-old child's growth and development. Which activity should the nurse expect the child to be capable of performing? Select all that apply. 1. Dresses self. 2. Uses toy tools. 3. Hops on one foot. 4. Rides a 2-wheel bicycle. 5. Swims using the freestyle stroke. The correct answers are 1. Dresses self. 2. Uses toy tools. And 3. Hops on one foot. Rationale. Preschool-age children have the fine motor skills to open and close zippers and buttons. Preschool-age children have the motor skills necessary to manipulate a toy tool, such as a hammer. Preschool-age children have the gross motor skills and balance to be able to hop and skip on one foot, balance on one foot, and perform a broad jump. Preschool-age children do not have the strength and balance to ride a 2-wheel bicycle. A preschooler usually can ride a tricycle. School-age children, not preschool-age children, usually are able to ride a 2-wheel bicycle. Preschool-age children do not have the strength and coordination to swim using the freestyle stroke. Some preschool-age children are able to do the doggy paddle. School-age children, not preschool-age children, usually are able to swim using the freestyle stroke. After arriving at a home location that has a history of domestic violence, a home care nurse believes that the environment may be unsafe. Which is the best nursing action? 1. Leave the home immediately. 2. Defuse the situation in the home. 3. Call the police for a personal escort. 4. Complete the visit quickly while remaining alert. The correct answer is 1. Leave the home immediately. Rationale: nurses must remove themselves immediately from any environment that they believe is unsafe. Attempting to defuse the situation may make the situation worse and place the nurse at additional risk. Calling the police may inflame the situation or take too long for an officer to arrive. Attempting to complete the visit may place the nurse at additional risk. A nurse identifies that an adult has an unresolved developmental conflict associated with adolescence. Which behavior supports this conclusion? Select all that apply. 1. Being overly concerned about following daily routines. 2. Requiring excessive attention from others. 3. Relying on oneself rather than others. 4. Failing to express a sense of self. 5. Lacking goals in life. The correct answers are 4. Failing to express a sense of self, and 5. Lacking goals in life. Rationale: a main developmental task of adolescence is being capable of determining who you are. An inability to express a sense of self later in life reflects an unresolved conflict of identity versus role confusion. A main developmental task of adolescence is forming a sense of personal identity as a foundation for the tasks of young adulthood, making decisions regarding career choices, and selecting a mate. An adult who has difficulty setting goals in life indicates an unresolved conflict of identity versus role confusion. 1. This relates to Freud's anal stage of development. According to Freud, if a parent is strict, overbearing, and oppressive during toilet training, the child may develop traits of an anal retentive personality. Seeking excessive attention from others is most likely the result of an unresolved task of the 6 to 12-year-old age group, industry versus inferiority. Seeking attention often is an attempt to increase self-esteem. People who have difficulty accepting help from others or who would rather do things themselves generally have not completely resolved the developmental task of infancy. Trust versus mistrust. A nurse must collect information about a community to identify its needs. Which is the most significant assessment by the nurse? 1. The demographics of the community. 2. What the community thinks is important. 3. How many support services are available. 4. Environmental data as they relate to public safety. The correct answer is 2. What the community thinks is important. Rationale: the members in the community are the primary source of data about the community and its needs. Just as the client is the center of the healthcare team when caring for an individual, the collective membership of a community is the center of the healthcare team when caring for the healthcare needs of a community. A nurse identifies that a client in middle adulthood is experiencing a developmental crisis. Which of the person's behaviors supports this conclusion? Select all that apply. 1. Unable to mentor children in the next generation. 2. Difficulty in developing peer relationships. 3. Inability to achieve feelings of success. 4. Incapable of delaying satisfaction. 5. Failure to face eventual death. The correct answers are 1. Unable to mentor children in the next generation, and 3. Inability to achieve feelings of success. Rationale: a task associated with middle adulthood is sharing of self and performing activities that promote the growth of others, particularly those in the next generation. A major task of middle adulthood is successfully fulfilling lifelong goals that involve family, career, and society. If these goals are not achieved, a crisis often is precipitated. Developing peer relationships is one of the developmental tasks of the 6 to 12-year-old child and adolescent, not the middle-aged adult. Delaying satisfaction is one of the developmental tasks of the 18-month to 3-year-old child, not the middle-aged adult. Facing death is one of the developmental tasks of the 65-year-old and older adult, not the middle-aged adult. A woman is concerned about her children accidentally ingesting her husband's prescribed medications. Where should the home care nurse teach the mother to keep medications? 1. On a high shelf. 2. In a locked cabinet. 3. In a medicine cabinet in the bathroom. 4. On a shelf in the back of the refrigerator. The correct answer is 2. In a locked cabinet. Rationale: a locked area is the safest place to store prescribed as well as over-the-counter medications to prevent accidental ingestion by children. A high shelf, medicine cabinet in the bathroom, a shelf in the back of the refrigerator are not safe places to keep medications. Children have natural curiosity, problem-solving abilities, and the agility to climb to a top shelf. A nurse identifies which word is being related to a principle of growth and development. Select all that apply. 1. Predictable. 2. Sequential. 3. Integrated. 4. Complex. 5. Static. The correct answers are 1. Predictable, 2. Sequential, 3. Integrated, and 4. Complex. Rationale. Growth and development comprise an orderly process that follows a predictable path. There are 3 predictable patterns. Cephalocaudal, proceeding from head to toe, proximo-distal, progressing from gross motor to fine motor movements, and symmetrical, both sides developing equally. Growth is marked by measurable changes in the physical aspects of the life cycle, and development is marked by behavioral changes that occur because of achievement of developmental tasks and their resulting functional abilities and skills. Growth and development follow a sequential timetable whereby multiple dynamic changes occur in a systematic and orderly manner. Individuals grow and develop in the physiological, cognitive, psychosocial, moral, and spiritual realms in an integrated way, with each one influencing the others. Growth and development comprise a complex process that involves multiple influencing variables, such as genetics, experience, health, culture, and environment. The word static means stationary, stagnant, or fixed. Growth and development are dynamic and progressive. A client's contract for home care services is about to end, but the client still requires care. On which factor will the continuation of services initially depend? 1. Nursing documentation of the need for care. 2. Retrospective audits of quality management. 3. Client satisfaction with the care being provided. 4. Presence of a primary healthcare provider's prescription. The correct answer is 1. Nursing documentation of the need for care. Rationale. Case management by the nurse in the home care setting includes determining whether a client is ready for discharge or requires a continuation of services. The nurse must document objectively the status of the client to convince those making the decision that the client requires a continuation of services. Nursing documentation is the initial intervention that supports the decision to continue home care services. Quality management activities are unrelated to whether a client is to receive a continuation of services or is to be discharged from a home health care program. Ongoing quality management programs are designed to monitor the quality of care being delivered and identify problem areas so that efforts can be employed to improve care. Dissatisfaction with the services of a home health agency may influence whether or not the client and/or family wants a continuation of services. However, satisfaction or dissatisfaction should not influence whether the client still needs the services of the home health care agency. Ultimately, a primary health care provider's prescription is necessary to initiate home care services, continue health care services, and identify interventions to be performed by nurses that are within the scope of nursing practice. However, the healthcare provider's prescriptions take into consideration nursing documentation of the need for care and input from agency managers and the client's insurer. A nurse is facilitating a mother's class, and the women begin discussing experiences that reflect the intellectual development of their children. Each woman describes a situation that reflects one of the stages of Jean Piaget's theory about logical thinking. Place the situations described in order, beginning with the sensory-motor stage and ending with formal operations. 1. My son touched the radiator and got burned. He'll never do that again. 2. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on the debating team in school. We go to inter-school meets. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed. The correct order is 1. My son touched the radiator and got burned. He'll never do that again. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed. 2. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on a debating team in school. We go to inter-school meets. Rationale. The sensory-motor stage, birth to 2 years, is governed by sensations in which simple learning takes place. It progresses from reflex activity through repetitive behaviors to imitative behavior. These children are curious, experiment, and learn primarily through trial and error. The preoperational stage, 2 to 7 years, involves thinking that is concrete and tangible. These children cannot reason beyond the observable. Also, their thinking is transductive. That is, knowledge of one characteristic is transferred to another. The concrete operational stage, 7 to 11 years, reflects an increasing ability to use symbols and understand relationships between things and ideas. Judgments are made based on what they reason rather than just what they see. Also, they develop the concept of conservation. That is, physical remain the same even though outward appearances may change. The formal operational stage, 11 to 15 years, involves thinking that is abstract, theoretical, philosophical, and hypothetical. Thinking is characterized by flexibility, adaptability, and drawing logical conclusions. A nurse identifies the healthcare needs of the members of a community, which is the nurse's most efficient initial approach to meet these needs. 1. Involve community leaders to work within the political arena to obtain funding for programs. 2. Write research grants to explore the community's health needs in more detail. 3. Design educational programs that address the identified community needs. 4. Make clients aware of the resources in the community. The correct answer is 4. Make clients aware of the resources in the community. Rationale. Option 4 is the most efficient initial approach to meeting the identified needs of the members of the community. The use of currently available resources is more efficient than the other options presented. Option 1 is not the most efficient approach. This may be necessary if present resources are not available to meet the needs of the community. In Option 2, the health needs of the members of the community are identified already. Further study at this time does not appear to be appropriate. In Option 3, designing educational approaches is not the most efficient approach. This may eventually be done after an action in another option is implemented first. Which common physiological change associated with aging should the nurse assess for an older adult? Select all that apply. 1. Increase in sebaceous gland activity. 2. Deterioration of joint cartilage. 3. Loss of social support system. 4. Decreased hearing acuity. 5. Increased need for sleep. The correct answers are 2. Deterioration of joint cartilage, and 4. Decreased hearing acuity. Rationale. Older adults generally experience a deterioration of the hyaline cartilage surface of joints, which tears, allowing bones to be in direct contact with each other. Often, this results in the formation of spurs or projecting points that limit joint motion. Hearing acuity decreases, particularly in relation to high-pitched sounds, because of atrophy in the organ of chordae and cochlear neurons, loss of sensory hair cells, and degeneration of the stria vascularis. Although sebaceous glands increase in size with age, the amount of sebum produced decreases, hastening the evaporation of water from the stratum corneum and resulting in cracked, dry skin. Loss of a social support system is a psychosocial, not physiological, change commonly experienced by older adults. Older adults have the same need for sleep as younger individuals. However, it is more difficult for older adults to obtain the quality and quantity of sleep desired. Chemical, structural, and functional changes in the nervous system disrupt circadian rhythms and sleep. A home care nurse is performing an initial client and home assessment, which is the most essential assessment that must be made by the nurse. 1. Can the home environment support the safety of the client? 2. Is the family willing to participate in the client's recovery? 3. Does the client have the potential for self-care? 4. Can the client participate in the plan of care? The correct answer is 1. Can the home environment support the safety of the client? Rationale. The first and most important assessment made by the home care nurse focuses on determining whether the client's home environment is safe. Safety and security are one of the more basic needs identified by Maslow's hierarchy of needs. Although it is often helpful when family members participate in a home care client's recovery, it is not necessary. A client's potential for self-care is not a criterion for receiving home care services. Clients who have little or no potential for self-care receive home care services. Clients who are unable to participate in the plan of care because they are mentally, emotionally, or physically disabled are still eligible for home care. A nurse determines that, according to Erickson, establishing relationships based on commitment mainly occurs in which stage of psychosocial development? 1. Middle-aged adulthood. 2. Young adulthood. 3. Adolescence. 4. Infancy. The correct answer is 2. Young adulthood. Rationale. Young adults, 18 to 25 years. Intimacy versus isolation. Strive to establish mature relationships, commit to suitable partners, and develop social and work roles acceptable to society. Unsuccessful resolution results in self-absorption, egocentricity, and emotional isolation. Middle-aged adults, 25 to 45 years. Generativity versus stagnation. Strive to fulfill life goals associated with family, career, and society, as well as to give to and care for others. Adolescence, 12 to 20 years. Identity versus role confusion. Strive to make the transition from childhood to adulthood with a sense of personal self. Infants, newborn to 18 months. Trust versus mistrust. Strive to have their needs met through interacting with others. When their needs are consistently met, they develop a sense of trust in their caregivers. During the process of performing a community assessment, the nurse invites members of the community to come to a meeting and share opinions and concerns about a particular issue, which is this method of data collection. 1. An opinion survey. 2. a community forum. 3. A demographic assessment. 4. An observation of participants. The correct answer is 2. A community forum. Rationale. A forum is defined as an opportunity for open discussion, inviting people from the community to share opinions and concerns about a particular issue for the purpose of collecting data is called a community forum. An opinion survey is designed to collect each individual person's perspective about the problem being studied. Results are tallied to identify the major concerns. Opinion surveys generally are questionnaires. A demographic assessment is the quantitative study of the characteristics of a population. A demographic assessment might include information such as distribution of the population by gender, size, growth, density, and ethnicity. Direct observation is a method of data collection that may be used to determine whether individuals follow a specific procedure or behave in an expected manner. A school nurse is teaching a class of adolescents about nutrition. Which age group should the nurse identify as having the highest energy expenditure and nutrient requirements? 1. End of the life cycle. 2. Middle adult years. 3. Early adult years. 4. First year of life. The correct answer is 4. First year of life. Rationale. During the first year of life, nutritional needs per unit of body weight are the greatest in comparison to any other time during the lifespan. Birth weight generally doubles in 4 to 6 months and triples by the end of the first year. Older adults experience decreases in basal metabolic rate, lean body mass, and physical activity that contribute to a decrease in caloric needs. Energy expenditure decreases, and nutritional needs stabilize during the middle adult years. People in other age groups have greater needs for nutrients to meet physiological demands than do those in the middle adult years. Although young adults tend to be active and require nutrients adequate to meet high energy expenditure, physical growth slows and the basal metabolic rate begins to stabilize, so they require fewer calories than do other age groups. A nurse must conduct a community assessment. Which information should the nurse collect first? 1. General health of community members. 2. Characteristics of community members. 3. Physical environment of the community. 4. Social services available in the community. The correct answer is 2. Characteristics of community members. Rationale. Clients are the center of all healthcare, including community healthcare. Acquiring core information about the people in the community is the first stage in assessing a community. Core characteristics about the members of a community include information such as vital statistics, values and beliefs, demographics, religious groups, and so on. A hospice nurse is providing emotional support for 8 young children of a dying mother. At which age do children first recognize that death is irreversible, universal, and natural? 1. 9 years of age. 2. 6 years of age. 3. 15 years of age. 4. 12 years of age. The correct answer is 1. 9 years of age. Rationale. A 9-year-old child has a more realistic understanding of death than a younger child and recognizes that death is universal, irreversible, and natural. A 9-year-old child has a beginning knowledge of his or her own mortality and may fear death. A 6-year-old child is developing an understanding of the differences among the concepts of past, present, and future. A 6-year-old child believes that death is temporary, can be caused by bad thoughts, and may be a punishment, and that magic can make the dead person alive. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 15 years. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 12 years. A home care nurse is providing care for a family supporting a client with a chronic illness. Which is the most important factor the nurse should teach caregivers who care for a family member who has a stable but chronic illness and is living in the home? 1. Have extra equipment and supplies for emergencies. 2. Plan a daily and monthly schedule of activities. 3. Keep a daily journal of the client status. 4. Tend to themselves as well as the client. The correct answer is 4. Tend to themselves as well as the client. Rationale. Caregiver role strain experienced by a family member is a serious concern of home care nurses. Caregivers often fail to address their own health needs because of the extraordinary burden of the caregiver role, which can jeopardize their own health and well-being. Caregivers should be encouraged to delegate responsibilities to other family members, get adequate sleep, rest, and nutritional intake, seek assistance from agencies that provide respite services, take time for leisure activities and a vacation, and join a caregiver support group. Option 1 is a good idea. It is not the most important factor a home care nurse can convey to a person caring for a family member in the home. Option 2 might contribute to efficiency, as well as gaining a feeling of control over the activities that must be accomplished. It is not the most important factor a home care nurse can convey to a person caring for a family member in the home. A nurse is caring for several children on a pediatric unit. Children in which age group should the nurse expect will be most unstable and challenging with regard to the development of a personal identity? 1. Toddlerhood. 2. Adolescence. 3. Childhood. 4. Infancy. The correct answer is 2. Adolescence. Rationale. Adolescence, 12 to 20 years. Identity versus role confusion, have more multiple and complex milestones than individuals in any other stage of development. These milestones are physiological, psychological, and social. The multiplicity of these stressors can have a major impact on the development of the adolescent's personal identity and sense of self. Although toddlers, 18 months to 3 years, early childhood, autonomy versus shame and doubt, experience a number of developmental milestones, toddlerhood is not as unstable or complex as another stage of development. Toddlers explore and test the environment, develop independence, and have a beginning ability to control the self. Although children in early childhood or toddlerhood, 18 months to 3 years, autonomy versus shame and doubt, and late childhood, 3 to 6 years, initiative versus guilt, experience a number of developmental milestones, their development is not as unstable or complex as that of another age group. The main tasks of childhood are achievement of self-control, initiation of one's own activities, and development of purpose and competence. Although infants, birth to 18 months, trust versus mistrust, experience a number of developmental milestones, their development is not as unstable or complex as that of another age group. The main tasks of infancy are to adjust to living in and responding to the environment and to develop trust. A community health nurse is to care for a client who was just discharged from an acute care facility after receiving initial medical care for tuberculosis. The family recently immigrated to the country from another country. Place the following interventions in the order in which they should be performed by the nurse. 1. Explore community resources that can help support the client and family. 2. Perform an assessment of the client and home environment. 3. Meet with the client and family in their home. 4. Review the client's medical record. 5. Identify client and family needs. The correct order is 4. Review the client's medical record. 3. Meet with the client and family in their home. 2. Perform an assessment of the client and home environment. 5. Identify client and family needs. And 1. Explore community resources that can help support the client and family. Rationale. Before meeting with the client and family, the nurse should obtain as much information about the client as possible. An assessment of the home environment can be performed only in the home. The client's family members should be included when feasible because they may provide emotional support and/or be involved with physical care of the client. A health history and physical assessment of the client should be performed by the community health nurse. The information on the client's clinical record may not reflect the client's current status. The home must be assessed to ensure that it is a safe environment for the client and that care can be delivered adequately to meet the client's needs. The nurse, in conjunction with the client, must identify present needs. Once this is accomplished, then goals and objectives can be identified and a plan of care formulated. Once a plan of care is formulated, then the nurse, in conjunction with the client, can identify community resources that may assist them in attaining the goals and objectives of the plan of care. A nurse is planning a teaching session for an older adult about a prescribed medication regimen, which is a major concern about older adults that the nurse should consider. 1. They experience an increase in absorption of drugs from the gastrointestinal tract. 2. They are less motivated to follow a prescribed drug regimen. 3. They are less likely to learn due to a decline in intelligence. 4. They have a decreased risk for adverse reactions to drugs. The correct answer is 2. They are less motivated to follow a prescribed drug regimen. Rationale. The literature documents that older adults are at high risk for non-adherence to a medication regimen because of its complexity. The larger the number of medications and the larger the number of doses per day, the higher the risk of non-adherence. One study indicated that the adherence rate was 87% for daily dosing, 81% for doses twice a day, 77% for doses 3 times a day, and 39% for doses 4 times a day. Other reasons for not fully adhering to a drug regimen include inconvenience, side effects, financial limitations, and/or perceived ineffectiveness of the drugs. Which statement reflects hospice care in the healthcare delivery system? Select all that apply. 1. Clients predicted to have less than half a year to receive services. 2. It assists families to care for their dying relatives at home. 3. Care is less expensive than in the acute care setting. 4. Support is given to the client and family members. 5. Hospice is a method of care rather than a location. The correct answers are 1. Clients predicted to have less than half a year to live receive services. 2. It assists families to care for their dying relatives at home. 3. Care is less expensive than in the acute care setting. 4. Support is given to the client and family members. And 5. Hospice is a method of care rather than a location. Rationale. To be eligible for hospice services, individuals are predicted to have less than 6 months to live. It is a service to support clients and their families through the process of dying. Most hospice care is delivered in clients' homes supported by a team of healthcare providers and volunteers. However, there are inpatient hospice programs, palliative care units in hospitals, and residential hospice settings. The majority of hospice care is provided in the home. The home is a less expensive setting than other healthcare settings because family members provide most of the care, supported by a team of professionals, non-professionals, and volunteers. Hospice services provide supportive care, physical care, and promotion of the quality of life for the terminally ill client and family members. In addition, hospice care assists family members with bereavement and adjustment after the death of the client. Hospice is not a location, but a concept. It provides supportive, palliative services that focus on managing pain, treatment of symptoms, and helping clients maintain their quality of life so they can live the remainder of their lives to the fullest. Which concept is reflective of Erik Erikson's theory of personality development? 1. Defense mechanisms help people to cope with anxiety. 2. Moral maturity is a central theme in all stages of development. 3. Achievement of developmental goals is affected by the social environment. 4. 2 continual processes, assimilation and accommodation, stimulate intellectual growth. The correct answer is 3. Achievement of developmental goals is affected by the social environment. Rationale. Erik Erikson expanded on Freud's theory of personality development by giving equal emphasis to the influence of a person's social and cultural environment. He stressed that psychosocial development depends on an interactive process between the physical and emotional variables during a person's life at 8 distinct stages. Each stage requires resolution of a developmental conflict that has opposite outcomes, and that requires interaction within the self and with others in the environment. Sigmund Freud, not Erik Erikson, identified that defense mechanisms are used to reduce anxiety by preventing conscious awareness of threatening thoughts or feelings. Lawrence Kohlberg, not Erik Erikson, established a framework for understanding the development of moral maturity, which is the ability to recognize independently what is right and what is wrong. Assimilation and accommodation of new information necessary to stimulate intellectual growth comprise a concept basic to Jean Piaget's theory of cognitive development, not Erikson's theory of personality development. Assimilation involves the process of organizing new information into one's present body of knowledge, and accommodation involves rearranging and restructuring thought processes to deal with the imbalance caused by new information and thereby increase understanding. Identify the nursing intervention that reflects tertiary healthcare delivery. Select all that apply. 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. 3. Implementing a prescribed hemodialysis treatment. 4. Administering an influenza vaccine. 5. Changing a dressing after surgery. The correct answers are 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. And 3. Implementing a prescribed hemodialysis treatment. Rationale. Providing bereavement services is an example of a tertiary healthcare service. Tertiary care is associated with rehabilitation, long-term care, and care of the dying. Healthcare delivery includes primary, secondary, and tertiary care. Teaching a client how to use a wheelchair after a stroke is an example of a tertiary healthcare service. Tertiary services provide care related to rehabilitation. Implementing a prescribed hemodialysis treatment is an example of tertiary healthcare. Tertiary healthcare includes providing palliative care and supporting comfort and quality of life, as well as maximizing abilities in light of chronic or irreversible conditions. Immunizations are an example of primary, not tertiary, healthcare delivery. Primary healthcare is concerned with promoting health, preventing disease, and providing environmental protection and health education. Changing a dressing after surgery is care associated with the secondary, not tertiary, level of healthcare delivery. Secondary healthcare is associated with acute care, complex diagnosis and treatment of disease and illness, and emergency care. A 70-year-old client tells the nurse about experiencing problems with sleep and requests sleeping medication. Which concept associated with drug therapy and quality of sleep is important for the nurse to explain when providing nursing care for this client? 1. sedatives are not well tolerated by older adults. 2. Anti-anxiety drugs are the least helpful to support sleep. 3. Effectiveness of hypnotics increases with prolonged use. 4. Melatonin is a drug of choice for long-term use in sleep disorders. The correct answer is 1. Sedatives are not well tolerated by older adults. Rationale. Sedatives are not well tolerated by older adults because a decrease in the metabolism and excretion of the drug can result in toxicity. In addition, older adults may experience idiosyncratic effects. Anti-anxiety drugs depress the central nervous system and therefore are helpful in supporting sleep. The effectiveness of hypnotics decreases, not increases, with prolonged use. They should be used only as a short-term intervention because tolerance and rebound insomnia occur in approximately 4 weeks. Although melatonin demonstrates promise as a drug to support sleep, it is not the drug of choice because its safety and efficacy for long-term use are not yet established. Which activity is an example of an intervention associated with secondary healthcare delivery? Select all that apply. 1. Conducting a cardiac risk assessment for middle-aged adults. 2. Teaching a low-fat diet to a person with high cholesterol. 3. Immunization of a child during the first year of life. 4. Providing a class on smoking cessation. 5. Monthly breast self-examinations. The correct answer is 5. Monthly breast self-examinations. Rationale. Monthly breast self-examinations are associated with secondary healthcare services because they are concerned with detection of breast cancer. Option 1 is a primary, not secondary, healthcare delivery. Risk assessments for specific diseases are included in primary healthcare services. Primary healthcare services are concerned with generalized health promotion and specific protection against disease. In option 2, a low-fat diet generally is part of a medical management program for a person who is overweight or who has high cholesterol. This is a tertiary, not secondary healthcare service. Tertiary healthcare services are associated with attempts to reduce the extent and severity of a health problem in an effort to limit disability, as well as restore and maintain function. In option 3, administering an immunization is a primary, not secondary healthcare service. Primary healthcare services include protecting people from disease. Providing a class on smoking cessation is associated with primary, not secondary healthcare. Primary healthcare is associated with health promotion and illness prevention. When the nurse assesses an adult client, which client behavior may indicate an unresolved developmental task of infancy. 1. Avoiding assistance from others. 2. Rationalizing unacceptable behaviors. 3. Being overly concerned about cleanliness. 4. Apologizing constantly for small mistakes. The correct answer is 1. Avoiding assistance from others. Rationale. People who avoid help from others and who would rather do things themselves generally have not completely resolved the developmental task of trust versus mistrust during infancy. Rationalizing unacceptable behaviors is a defense mechanism, not an indication of an unresolved developmental task of infancy. Rationalization is used to justify in some socially acceptable way ideas, feelings, or behavior through explanations that appear to be logical. Option 3 relates more to the anal stage of Freud's psychosexual theory of development. Freud believed that when toilet training is approached in a rigid and demanding manner, a child develops into an adult who is overly concerned with orderliness and cleanliness. Option 4 indicate an unresolved conflict of autonomy versus shame and doubt associated with the 18-month to 3-year-old age group. One of the developmental tasks of this age group is learning right from wrong. When parents are overly critical and controlling, a child may be overly self-judgmental and become an adult who feels the need to apologize for small mistakes constantly.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.